without the delay, I think I will start my part of the presentation. Oh, let me pull up the share screen, okay. Do you see my screen? You do see my screen, do you?
Yes, we see.
Yeah. Okay. Okay, so welcome everyone, and welcome all the doctors from Zago. And it's my great pleasure, okay, to start this webinar by giving you an overview of the application of high-intensity focused ultrasound ablation in gynecology, okay? And so I think I'll leave Dr. Mozaza to introduce me later, so I'll go directly into my talk, okay? And so for those of you who it's the first time to hear about this technology called high intensity focused ultrasound, actually back in 2017, the Ultra Foundation in United States in their state of field report has already defined this as a game-changing, transformative, and leap forward, okay? And in the subsequent state of field report, they show that more than 100 indications are currently and different stage of clinical evaluation. So therefore, I mean, hopefully with my introduction and also with the two experts who is going to talk about their experience of using this technology in their respective medical institutions, and to give you a sense, to give you the message that we are entering actually the era of medicine, of non-invasive medicine. Okay, so first I would like to use this slides to briefly summarize what the principles of HIFU ablation. So HIFU tumor therapeutic system, okay, converts electric energy into acoustic energy through a transducer, okay? And then the ultrasound emitted by the transducer is focused onto target tissue to confer treatment. Okay, the temperature at the biological focal points will arise over 65 degrees, which will induce instantaneous and irreversible coagulative necrosis. And this is the fundamental principle of how HIFU can eradicate a tumor, ablate a tumor, okay? So the HIFU affords one-time precise resection, while the conformal ablation, if for those of you who watched the couple of videos we just played before the webinar, you already got a sense of that, okay? And the whole procedure can be performed under the real-time monitoring by either ultrasound or the MRI, okay? And this is the video, I think it's been played twice, okay, to explain how HIFU procedure is done, how it's different from the traditional procedure, the surgery. So I think to save the time, I'll skip this, okay? And so what is the strength of this technology? I think Dr. Raymond Sutton from South Africa will tell you more about it, okay? So first, it will reduce the burden on healthcare system, okay? As second is that actually it will bring many benefits to the patients, okay? So I leave Dr. Raymond to talk to you in his part of the talk. And so I will use the next few slides to give you a sum up of why we think this is the mature technology in OB/GYN for the treatment of fibroids, which is the common a common indication that occurs at a very high incidence in African women. Okay. And to let you know that it's why we think it's the time actually to work with Zago to set up the to bring the service to Zambia. Okay, so first, through vigorous clinical studies, okay, we have already established a favorable safety profile. Okay, and to sum it up, HIFU is a safe, procedure, okay, and it has less complications compared with conventional surgery such as hysterectomy, okay, or myomectomy for the treatment of fibroids, okay, and as importantly, because it's non-invasive, so it offers rapid recovery for the patient. So what I summarize here is using two clinical studies. One is a retrospective study on the left, which involves 10 centers and has 27,000 cases analyzed, okay? And the conclusion from this study shows that the class C complication rate is as low as 0.3%, okay? And the class D rate is as low as 0.05%. Class C and Class D complications are considered major complications, okay? And on the right is the study, actually 20-center prospective ideal trial. The trial is designed, study design is done by the Oxford team, and the 20 Chinese centers participated, and with the enrollment of 2,411 patients. In this prospective study, three surgical methods were compared side by side, which is hysterectomy, myomectomy, and HIFU, okay? And what I shows you here is the class C and D complication rate is in this prospective trial is also for HIFU is as low as 0.2%, which correlates very well with the 27,000 case retrospective study. Okay, and in the same study, the class C and D complication rate for myomectomy and for hysterectomy is around 10%, okay, which is also consistent what's being reported for these two forms of surgery. Okay. And also, when the doctors to consider whether this is already a technology I need to learn, I need to pay attention. It's whether it has developed into being entered the guidelines in the globally. Okay, so here, as I summarized it here. The HIFU for the treatment of uterine fibroids has already entered the UK I received the NICE recommendation in 2019. I think David will talk a bit more about it in his talk. And it received the US ACOG guideline, entered the ACOG guideline as early as 2008 for MI-guided HIFU, okay? And in China, KOGA, it enters the KOGA guideline in 2017. And in Canada, it all enters the SOGC guideline in 2015, and in the South Korea KSOG guideline in 2016. Okay. And also, for the dissemination of this technology, you will also ask whether an international training program has been developed. The answer is yes, okay? And in the past 2 years, we have bring the training program that have been developed in China to the international platform, and the ISMIF, which is the International Society of Minimally Invasive and Virtual Surgery, which Professor David Cranston is the current president of this society, okay? And so the training program will be a stepwise international training program to fit into the practice of the international doctors, and it will be a 3-step training program. Obviously, down the road, we are keen to working with professional societies of the given country when the service is established, to tailor the training program to the local doctors' needs. And also, to bring a new technology to the clinical practice, okay, we also need to build the international consensus among the doctors, okay, and in this case, because HIFU is currently the most mature field for its application and deployment, actually is in the OB/GYN field, okay. So by working with the regional and the national OG societies and the OG endoscopy societies, and also the fertility and reproductive medicine societies, okay. So on the left, this is a representative of a few of the key international professional organization has already formed a collaboration with ISMIF, okay, and to bring this technology to the international platform. So we hope to introduce HIFU therapy under the guidance of the professional societies, so the doctors will be properly informed, well-trained, and follow the training program to be well-trained to master this technology. Afterwards, we hope the well-trained specialists, okay, will integrate this technology into their medical practice and to make the decision which technology to use and to deliver this service to the patients. And also, we want to, by integrating this technology into the OB/GYN service practice, patients will also have a non-invasive option to choose. Okay, so currently the indications, OB/GYN indications for HIFU as I summarized in this slides. Okay, so the uterine fibroids, adenomyosis, we have performed the most cases from these two indications. And the cesarean scar pregnancy and placenta accreta, the number of cases that we've been performed internationally and has increasing. And the new to add to the indication is abdominal wall endometriosis. Okay, so the list of indications is increasing. Okay, and the Chinese doctors, who has already a good portion of them has already mastered this technology, are the pioneer of broadening the indications for HIFU. Okay, and we hope that upon learning these skills, this new treatment method, okay, so the specialists actually will bring their own interests and to the development of new indications for HIFU. Okay, so actually for you, probably it's a new technology, but I would like to share with you that cumulatively, okay, global cases of US guided HIFU therapy has already done over 180,000 cases. And 95% of these actually are in the OB/GYN cases, and mostly the uterine fibroids, adenomyosis. So in other words, okay, and so we not only have evidence-based evidence from clinical trials, but we also have in real life practice, okay, to inform us that this technology actually is ready to be deployed globally in the OB/GYN field, especially for the treatment of uterine fibroids and adenomyosis. Okay, and also like to share with you that, okay, we have already welcomed over 2,500 babies. Actually, the mothers call them HIFU babies because they were born to the mother and the patients who suffer from infertility due to the benign uterine diseases, but realized the dream of becoming a mother after receiving the treatment. Okay, and so for Chongqing HIFU Medical is leads the development of this field, both from the technology perspective, but also in the clinical application and the clinical dissemination. So we already have end users in 29 countries and regions of the global, and we have about 60 centers. Okay, so the first international center actually is the Oxford HIFU Center. And we set it up in 2001. And so Professor David Cranston, in his talk, actually will share with you the Oxford experience with this technology. And so here is the some of the profiles of our global end users. Okay, actually, if you're familiar with what the President Xi called the Belt and Road Initiative, our 60 centers has already covered and link the Belt and Road countries. Okay, and so now we have already 3 centers in Africa. So the directors of all 3 centers are on the webinar. Okay, and Dr. Raymond Satin from South African Center will share with you the experience with this technology. Actually, we are working, and one thing I would like to mention that, because how we do it is that we integrate the HIFU service with the local medical communities. Okay, in other words, by training the local doctors and the medical teams to master this technology. And so we're handing the service to the local medical community, and which allows them to serve the local patients more effectively and more efficiently, and also fits the local medical culture better. Okay, and I think this is very important. Okay, so actually, we are now having several projects undergoing. Okay, actually, Zambia project is one of it. Okay, so we envision that in next 3 to 5 years, we would like to bring this technology in the much rapid, rapidly, okay, to Africa, because we think this is a good technology for Africa. And Dr. Raymond Satin will tell you in his talk, and I think Professor Hamid and Dr. Ajayi will also share with you their experience in the question and answer period. Okay, and so here, for those of you who wonders how hard it is to set up a HIFU center, actually the requirement is much less than for setting up a operating theater. Okay, only a regular hospital room is required. Okay, and for the medical staff, it's a minimally HIFU doctor, a doctor, a nurse, and an anesthesiologist. Actually, depending on whether the doctor can do the sedation, because for the OB-GYN procedures, only sedation is required. Okay, so in many other countries, when the doctor can give the sedation agents, actually you don't need the anesthesiologist as well. Okay, so it can be set up as an outpatient procedure, actually at the day service. Okay, day surgery service for the benign and the non-tumor diseases, non-malignant diseases. And the hospitalization is necessary for HIFU treatment for the malignant tumors. Okay, so I think that most of the people who join this webinar are on the OB-GYN side. Okay, but if there's a doctors who are on the oncology side, I think usually we set up the OB-GYN service first, then will be broadened to other disciplines. Okay, and so we provide, so Chongqing HIFU Medical is a provider of a total solution. I summarize the total solution here. Okay, and to mention what need to be mentioned is that we, in addition to the system and providing the system, we have a comprehensive post-cell maintenance program. Okay, and also has a comprehensive clinical training program involving both coming to China to train and on-site training and on-site clinical support. In addition, we have developed the telemedicine enabled clinical support and post-cell maintenance capability. Okay, in the next slides, I would show a little bit more. And another thing worth mentioning is that, okay, it will also provide the participation in the activities of international academics and academics. Okay, and so this is the telemedicine service and a big data center, okay? So we use this platform actually to do telemedicine-enabled treatment planning, okay, for doctors who even learned, master this technology by encounter difficult cases, okay? And so in this function, all doctors actually can, through the telemedicine center, provide the clinical instructions, okay, to the doctors, and it feels like there's a doctor sit beside you, okay, and the delay and the 4G is 1 second. So in 5G, it will be no delay, okay, and we also use this platform to do post-sale maintenance, okay, and it's 24/7 checking up your system, okay. So we therefore about 70% of the small problems can be solved online, okay. And our training program also involves the training of a local engineer, okay. So far we have linked to the 120 centers within China and globally, okay? So for the doctors who are on the oncology side or even on the OB-GYN side and said, can we only use this to treat benign conditions, okay? The answer is no. Actually, you know, there is from this list to show you two things. One is that Chongqing HIFU Medical, okay, actually leads the clinical development of in this field. Almost all the first cases of treatment, new indications were done on the benign or malignant tumor side is done by the Chongqing HIFU, the Chinese team, okay? And so this also shows you, I think David will talk more because the Oxford Center devotes a tremendous of their attention to bring this technology to oncology to practice, okay? So the answer is yes, okay? We can also use this technology to treat malignant cancers. However, it is need to be developed more mature for the global-wide dissemination. Okay, so to finish my talk, I will use one, would like to use these two quotes, okay? One is from Sir William Osler, okay, who is the founding father of modern medicine, okay? And he says that diseases that harm requires therapies that harm less, okay? And the second quote is called treatments minimize harm to patients. And this is the core business value of Chongqing HIFU Medical, okay? Thank you for your attention.
Professor, thank you very much for your nice presentation.